Some of us have expressed the view rather strongly, the chamber particularly, that the Patient Protection and Affordable Care Act is the next big budget buster. Expands entitlements dramatically. We don't think it is paid for. Some rhetoric to the contrary from others. Are you concerned that that is going to become the next kind of Medicare crisis?
That's a softball if I've ever seen one.
Tried to make it not a leading question.
First of all, the ink was barely dry, and we got a new report from CBO, new report from Rick Foster, the chief actuary of Medicare and Medicaid. It's already deficit. This thing is already going to cost, because now we know it's going to be about $115 billion just for bureaucracy to run the thing. We've got to hire 16,500 IRS agents to police this mandate. Healthcare costs, according to the actuary, don't go down; they go up. So we're exacerbating the problem. The math was disguised when you had 10 years of tax increases, Medicare cuts to pay for 6 years of spending. When you add it all up on apples to apples, this thing's a huge deficit increase. And here's what it is. It's a new entitlement that will dwarf Medicare when it's all said and done. Because what we are doing with this entitlement is we are saying to everybody in America who makes less than 100 grand approximately, which is just about everybody, don't worry about it. If your health care expenses exceed 2 to 9.3% of your adjusted gross income, don't worry about it. The federal government will pay for the rest of it. It's the biggest open-ended entitlement we've ever created. Government misestimated or underestimated Medicare by a factor of 9 over a 12-year horizon when it was created. God only knows how much we're underestimating this thing. But if the private actuaries who for years have been monitoring healthcare costs and expenses are correct, this thing is going to be a huge entitlement that will rival the size and liabilities of Medicare in the very, very near future.